How to deal with schizophrenic patients. Schizophrenia, called as the cancer in psychiatric disease, is a serious mental disorder. It can be called as split personalities and split minds. These patients can't focus on their thoughts. Their thoughts lack proper orders. Pieces of thoughts can't making proper sense and getting difficult to store reflexes, make them unable to express themselves. Emotions and logical reasoning is what makes life meaningful. But those people suffering from this condition will be having lower IQs and EQs. I have experiencing in dealing with these kind of people. Their mind will be always preoccupied with auditory, visual hallucinations, and they will soon get alienated from outside realities. They will live in a dreamland. The characters of this dreamland will be past friends and influences. They will make wired stories about these person, after the brain signals show errors. Past memories and personal details will be in their brain. Patients suffering from this disease will develop some kind of bipolarity or fear, and they hence lack proper peace. This hinders the day-to-day lively activities of these people. Neglected and troubled childhood, fear influences from other psychic patients, prenatal and postpartum depression, stressful life and improper nutritioning, lack of stomach enzymes converting proteins into essential amino acids like tyrosine, lysine etc., premature birth, harmful environmental radicals exposure, and traumatic shock suddenly making distorted neural connection etc. can be reasons. The main thing is early finding of the behavioral, linguistic skills of people and initial treatment. Once the brain connection gets changed, it becomes permanent and management is the only option. Increased stress hormones like cortisol changing neural chemistry and they loses the optimal behaviors. The problems with medicine is they won't completely cross the blood-brain barriers, and permanent cure, medical science haven't found. EEG tests won't be helpful to these patients. Nowadays experts are of the opinion that childhood fits, exposure to viruses that cross blood-brain barriers early can cause this problem. Symptoms change from mild to greater intensity after time. At later stages, excessive guilt, suicidal tendencies, extreme enemities due to misunderstood realities, and if it progresses to paranoid schizophrenia, conditions will become worse. What medicine are actually doing is arresting the progression. It's a doubtful reality that influence of psychic patients, influence social harmony and affect those caretakers' personal lives also. Hence those people taking care of this, must be having greater intelligences, to manage the influences. Permanent solution for this is uncertain. Making the secretions of serotonin and other neurochemicals to balance. Making digestive system able to absorb essential amino acids in converted forms that make good moods. If it's presence of impure radicals, only possible way is to make liver and brain purify using neutralizing agents and antiviral if doctors feel so. It has to be noted that taking into consideration of all pedigrees, symptom progression and circumstances, doctors will start treatment and early diagnosis is what needed. Fear reduction and guilt reduction and diverting false thoughts by creating fear is found to very effective to give these patients no square.